My name is Abdul Wahab Mayahi. I am from Iraq. I came here desperate. I have 2 fistulas in my abdomen. Was never healing, but here with the ideas of Dr. Roger in Mediclinic hospital, they healed in a very short time. The last Tuesday, we did the surgery and discharged from hospital after 2 days. At the night of the surgery, I was walking at the corridors of the hospital.
We searched on the internet for Mediclinic Hospital and we saw the CV of Dr. Roger. It was a very good CV.
Because of Dr. Rogers, the healing of the 2 fistulas was very fast. It was healing for about 2-3 weeks, and this is great for me.
He told us the idea and it was a very complex surgery, but everything went very well.
I have a great staying here for those 2 nights. Great experiment with the staff, with the nurses, with everybody here. The services here in the hospital was very great. It was an amazing experiment. Really, this is a fact.
I am Dr. Roger Gerjy. I work as a consultant colorectal and general surgeon at Mediclinic City Hospital. This patient came to me in November 2022. He had previously done surgery in another country with a nephrectomy. That means removal of the left kidney. After the surgery, he got complications with a hole in his bowel, other things that needed extra surgery and bowel resection. He developed a connection between the small bowel and the skin, so bowel content could come out through the skin. When he came to me, we decided that we could treat this first conservative and then with the procedure. 1 week ago, he underwent the surgery where we could identify that he had not only this enterocutaneous fistula, the communication between the bowel and the skin, he had also a hernia in the scar and he had a big groin hernia. We had to do all those procedures together and we managed to do this with a minimal invasive technique using the Da Vinci robotic platform. And after a 3-4 hour procedure, we felt quite convenient that we helped this patient. After the surgery, he didn't have any complaints. He felt minimal of pain. He was moving around quite freely and he was able to eat and drink as normal. He was discharged 2 days after the surgery, and I saw him today 1 week after the procedure, and he was feeling fully normal and is ready to travel back home to his country.